Hey everyone, it's Dr. Hodges. I am here today with my friend Carrie Johnson.
Hello.
She is with Bariatric Advantage. As a little disclaimer, this is not a sponsored video by Bariatric Advantage, but I have used your products, oh my gosh, at least since 2011. They're a fantastic vitamin company and I recommend their vitamins to all of my patients. I also take these vitamins, and so Carrie has a wealth of knowledge, not just the fact that she works with them, but she's a registered dietitian. And so it's really great whenever we can pick her brain and figure out all these different little nuances. And so I have this vitamin series so we can discuss what my bariatric patients need, but then also for anybody that is in any medical weight loss program, or if you're just trying to stay healthy and you haven't had weight loss surgery, like what are the supplements that you really need to be taking on a day-to-day basis to make sure that you can optimize your health. So today we are going to talk about probiotics. And I like to talk about it because I used to think it was like a bunch of hogwash, actually. And I'm like, oh my God, that's why I'm in Western medicine, Like, I don't need to know all about the gut biome. And what's so interesting is now when I go to conference, like ASMBS, that's our metabolic society, they always have tons of different series talking about like nutrition, the gut biome, and how integral it has been now to just like overall body health, digestion, immunity, and inflammation.
Huge.
Like certainly, like we have known for years that cardiovascular disease, diabetes at the cellular level, that is all inflammation. We now know obesity is the same, like kind of like the root cause. And what's interesting is all that can be heavily also influenced by our gut biome. So what do I mean by gut biome? We got a lot of bugs in our belly. We have tons of bacterial strains. And so you're born with these different strains. We get them from just from our environment, actually from our mother. Actually, even whenever you're breastfeeding, you get your IgA, that's some of your antibodies that from your mom in your breast milk, but then also
it's different via C-section versus a vaginal birth as well.
Absolutely. So all of these play a role. And what I have found, what was so interesting is that in terms of weight, they have done studies where they've looked at patients that are overweight and obese, and then they looked at patients with a normal body weight, and they can have significant differences in the different strains of bacteria. We were talking about this earlier. Like they've done studies where they have taken little mice. So they'll have an obese mouse and a very thin mouse, and they'll do a fecal transfer. And that is exactly what you think it is. And they will take some feces from the little obese mouse, and they will put it in the rectum of they'll do a transfer into the thin mouse. And without changing the thin mouse's activity or their diet, they kind of see what's going to happen just by changing this gut biome. And those little thin mice, they gain some weight. They gain weight. They get big. And so what's interesting, and what I'll tell my patients, is sometimes what they found is certain strains of bacteria, they really help your body digest your food. And so some of them are like super producers. And so they're really good at helping to extract energy from your food, which I guess when we were cavemen, that was a good thing.
Right. But
now
so
we don't need that. We're not running from the saber-toothed tiger. So if you harbor a lot of these strains that are like these super producers, you're more prone to obesity. And so there are a couple of different probiotics that we recommend. Let's talk a little bit about this first one. This is really cool. So this is the Flora Vantage Control, and I'm starting to take this, and it is great for weight maintenance. So tell me a little bit about this.
So quick background on this. There was a particular study that was done for 6 months, and the subject in the study took the strain in this probiotic. It's Bifidobacterium lactis BIO7. They took that along with fiber every day, and for 6 months, over a 6-month period. And it was found that they actually ate less. So they said by around 300 calories or so a day.
Which is significant because if you are one of my patients, or if you've listened to any of my videos, I will tell you for you to lose a pound a week, you need to be in a calorie deficit every day of at least 500 calories.
Yep.
So
helped with that. And then another interesting finding, I won't go into all the findings, but another interesting one is waist circumference. Those that were doing this particular strain of probiotic along with fiber, they actually, their waist circumference decreased by about an inch.
that is
Over 6
significant.
months. So
That's significant, especially when we're looking at our cardiovascular health. And if you're looking at different studies, to see like what is your risk for heart attack or some of these other different cardiovascular diseases. We're always talking about visceral abdominal fat, and that means the fat that is deep inside the belly, not like, when you're like, I can pinch an inch. That's your subcutaneous fat. So that's like what's above the muscle. Typically when they're talking about changes in your waist circumference, they're actually talking about changes on the fat that is inside your abdomen, because that's the fat that is inside the abdomen. That's what can cause the most havoc on your cardiovascular system. That's where the problem is. So the fact that they have found that this particular strain of bacteria can help control that, I think that's huge.
yeah. Well, and this also too, and I won't go into all the details in science, but there's a new something called a postbiotic, and I'll just call it Akkermansia. Is the one that this product actually, in this study, increased the Akkermansia levels in these participants as well. And Akkermansia is actually, it kind of goes back to your mice. Akkermansia is found in lean subjects. In obese subjects, they don't have as much of this particular bacteria in their gut. So now you can actually, in Metagenics, who Bariatric Advantage is owned by, actually has a product that has this B420 plus additional Akkermansia in it, along with some fiber. So really helping all three of those, putting all three of those together. So the fiber that we're taking here, the B420, Akkermansia. Akkermansia has actually been found in studies after surgery to increase, after bariatric surgery, that increased level of Akkermansia. Yep. So this product in itself can increase Akkermansia as well. But then there's also products
that have
Akkermansia in it. Yeah.
I think that's awesome because there's kind of two parts to weight loss. There is losing the weight, which is difficult.
Right.
But I actually think what is more difficult is that maintenance. Yeah. If you are and which is why, now granted I'm a surgeon, so of course I'm going to like surgery, but all the studies show that surgery is far superior to medical weight loss. And I think the recidivism rate for weight regain with medical weight loss is about 98%.
Oh, is it? Wow. Yeah.
That's a lot.
Yeah.
Whereas the success rate for weight loss surgery is anywhere from 85 to 90% success, meaning keeping that weight off. Yeah. And I feel like so many of us, we can gain or lose 5 to 10 pounds, but I feel like once you need to lose more than 30 to 40 pounds, you might as well lose 140.
Yeah.
You know what I mean?
Yeah.
And so anything that you can do on a daily basis to help you with maintaining that wonderful weight loss success, anything can help. So Flora Vantage Control, I'll have this link below. I have it in my store. It is really good. It's just a really small capsule. You take it every day. I don't have the bottle in front of me, but they have two other probiotics. Oh my gosh, what's the one that I love? It's the purple one.
So it's Flora Vantage chewable. And then it also comes in a capsule, Flora Vantage Balance.
Get the chewable.
The chewable is the way to go.
It tastes like a grape sweet tart. Oh my God. And we're not exaggerating. It is so good.
So good. And it's a great product too. So it has two strains of probiotics. So tongue twisters, Lactobacillus acidophilus NCFM, and then it also has a strain called Bifidobacterium lactis BIO7. And those two strains have around 85 clinical studies done on those two particular ones, and they've been shown to really help with our gut health. So gas, bloating, constipation, diarrhea, all of that fun stuff. Also, probiotics are good for our immune health too. But yeah, if you're having issues with those types of symptoms, the FloraVantage chewable is a great option for that.
And I'm telling you, if you are one of my patients and you've come to see me and you're having issues with constipation or diarrhea, or let's say you haven't had those issues before, but you just came off of an antibiotic for some reason, or maybe you just had your gallbladder out and you're having looser stool. Everybody knows the very first thing I'm going to tell you is, are you on a good probiotic?
Right.
You got to get on a probiotic. You need to get on. And I really like the FloraVantage. And I will tell you, looking at the cost is going to be the exact same as a line.
Oh,
So,
yeah.
So I'm like, you might as well get one that's bariatric formulated. That tastes good. So,
Exactly.
You know what I mean?
And with the antibiotics, I remember, when you were a kid taking antibiotics, eat a cup of yogurt, because it has that good bacteria in it. But now we have these targeted probiotics that we can just take. I mean, yogurt's still great, but yeah, we can add in these probiotics to help, especially when you're taking an antibiotic.
Exactly. Yep. And it's, I know so I'm 49 right now. And I remember when I was 45, I had my first screening colonoscopy. So if you haven't had it and you're 45, you need to go get your screening colonoscopy. Okay, go get it done. And everything was clean as a whistle. I don't need to go back for another 10 years. But your colon has to be cleaned out. Okay, cleaned out for them to get good visualization. My God, I'm regular. I was not right.
Oh, you weren't?
Oh, girl.
Oh, really?
No, I'm talking like for the next 3 weeks after my colonoscopy. Now, I don't think this is typical, but I ate a bunch of yogurt, and when I tell you I was pounding this stuff.
Yeah. Really?
Wow. And I was eating some kimchi.
Oh, yeah.
You got to get all that up in there.
Kimchi, sauerkraut, all that.
Yes, because those are all some really good prebiotics. I've done a couple of different videos on a FODMAP diet, and the FODMAP diet is also linked directly to your gut biome.
Right.
And what they found is that there are certain bacteria in your gut that for some people, they just go to town on certain foods that you eat. So FODMAP stands for fermentable foods, oligosaccharides, disaccharides, monosaccharides, and polyols. And so let's say you eat a certain food. So for me, if I eat a raw onion, the gut and my bacteria, they go to town, and I will get bloated. Oh, that's the same. I can't do stevia.
Oh, does it happen with stevia too?
Yeah, I cannot. Oh my goodness. No. I know Chick-fil-A, there's a Chick-fil-A right around the corner. And I used to always go get their sugar-free lemonade.
So good.
It is so good. And I did not understand why, like in the afternoon in clinic, it would like hurt for me to kind of sit down. I would sometimes feel like I needed to pop my bra because I would get really bloated.
And it was all from the stevia.
Mm-hmm.
Wow.
Yeah, I cannot do stevia. And so I always try to clearly educate my patients, the bacteria in your gut play a huge role in how you feel. If you're pooping every day, you need to be pooping every day. Mm-hmm. I will have patients that come to see me and they're like, oh, for me it's normal. I go once a week. And I'm like, that's not normal.
No. What is it after? I want to say there was a dietitian I used to work with who would say, if you haven't gone in 3 days, is it considered constipation? Is that right?
Yeah. Yes. I mean, I'll ask patients, when they come to see me for their 1 week follow-up after surgery, and you're prone to constipation, you're dehydrated, you're taking narcotic pain medicine.
Just not eating that much.
No, you're not. No, you're not.
Yeah.
You're dehydrated, all that. And I will ask them, so when was your last bowel movement? And they're like, and as soon as they say that, I'm like, that's too long.
That's not good.
If you have to dig out your calendar to figure it out, you've waited, that's way too long.
Mm-hmm.
So
okay.
I recommend a really good probiotic for every patient. Now, as a side note, this is not one of Carrie's vitamins, but there is one if I have patients that are coming to see me and they have really, really bad diarrhea.
Yeah.
There is one that is called VSL3.
Oh, okay.
And I need to go and look and see what the formulation of that is. It is really good. In particular, it was formulated for people with IBS.
Okay.
And so I need to go and look and see what the actual little bacterial strains are.
Yeah.
Because
And that's the other thing too. I think a lot of times when we look at probiotics, you just go to Amazon and you buy a probiotic.
Yeah.
But it's really, the most important thing is the strain.
Right.
So like we talked about this Bifidobacterium lactis BIO7 in this particular product.
For the one for the control.
Right. So that B420 is the strain, right?
Right.
And then we have the Bifidobacterium lactis BIO7 that we talked about in the other product. That BIO7 is the strain, and it does something and works on completely different things than this B420 strain. So that's one thing I always talk about too, is just really making sure it's strain specific.
Right.
We know there's studies on it. We know what it's truly intended for, right?
Right.
So that was just a side note, I guess.
No, I think that that's a really good point to make, because I know for a lot of my patients when they come to see me, I mean, again, everybody, you want to get something good, but you want to get a good deal. Do you know what I mean?
Right.
And unfortunately, sometimes there are things that are a good deal, but that you're not really getting what you need. And then it's like, listen, if you don't want to buy this, you don't have to buy it.
Right.
Okay. But also, don't go waste your money on something that's not really, because there's also a lot of like wishy-washy like science, out there. And so what I appreciate about these probiotics is that these particular strains are strains that have numerous studies.
Exactly. Yeah.
And that's actually what's important.
Well, and two, you could go to Amazon or wherever, Whole Foods,
right,
Walmart, Walgreens,
mm-hmm.
and you can buy a probiotic that has 15 different probiotics in them, but they're not strain specific. So you really don't know what strain of Lactobacillus acidophilus you're getting, and really is this going to do anything for me?
Right.
So you want those, like you said, that have science behind them.
Absolutely. Like I get really, as a side note, like I get really picky about my turmeric that I take.
Mm-hmm.
And I have taken like every form of turmeric, and there's like one kind that I really like. And I know it has to do just with the formulation. Yeah. So I think that's what's important.
Yeah.
So if you're going to take something, don't waste your money. Take something that's good.
Yeah. That you know is going to benefit you.
Exactly.
Yeah.
So the Flora Vantage Control, that's something that you just take one a day, and that's the control. So think of weight control. That one really, really helps with weight maintenance. But certainly if you're also in a diet program, or if you're a bariatric patient and you're actively losing weight, this is going to be good for that. It's really going to help support and get more of those good bacterial strains in your gut to help you with weight maintenance. And then their other Flora Vantage is just a really good overall good probiotic for really good gut health. It's going to be really important too if you've had a recent sickness and you've been on antibiotic. Antibiotics are sometimes non-discriminatory, so they're going to kill off even the good stuff that's in your gut. And that's why sometimes you get gut upset with some sicknesses. It's because your gut flora is off.
Yeah.
So,
and I will say most of the time, probiotics don't fix you overnight. Like
no.
We have to build them up in our system, really get that good bacteria built back up, especially after we've taken a antibiotic. So.
Yes. So, and that's one thing. I'm so glad you said that. Vitamins, hair care, skin care, none of this is something that's going to happen like right overnight. So for instance, like if your glucose was through the roof, I could give you a shot of insulin.
Yep.
Your glucose will go down immediately. That's not how any of this works. So for instance, like if I'm using Latisse on my eyelashes, that takes like at least 8 weeks, because that's the growth cycle. If you want your hair to regrow, you need good vitamins, you need good protein. The hair life cycle, again, is about 8 weeks. So you're not going to really start to see good growth for a good 2 months. That's really going to be the same. Oh, also, if you're on a skincare program, if you're seeing a dermatologist and you're suffering from acne, they're probably going to tell you it's going to take a good like 4 to 6 weeks to really start to see some good changes in your skin. That's going to be the same whenever you're taking these different probiotics. It just takes time. So don't give up after a week. Your symptoms didn't happen overnight, so they're not going to go away. Not going to go away overnight. So, okay, but I hope that this helped, and you guys check this out. I'll have everything linked below. You can see it on my link tree, and also I have my store at Bariatric Advantage. My code is CHMD. So hope that this helped.